Hi, my name is Dr. Mytien Goldberg. I'm a board-certified plastic surgeon in Beverly Hills. I specialize in breast augmentation revision, and all form of breast reconstruction. Today, I'll discuss a hot topic in plastic surgery, which is what plane should a plastic surgeon place breast implants? So there are currently three main types of breast augmentation where a plastic surgeon can either put a breast implant underneath the muscle, what we call a subpectoral breast augmentation, completely under the muscle, or the second option is a dual plane or partially underneath the pectoralis major muscle, or subfascial or subglandular, which is above the muscle. Dual plane breast augmentation has become the technique. Every new plastic surgeon trainees learn how to do breast augmentation. That was how I learned to do breast augmentation until I talked to practitioners from South America and from Asia and Europe, where plastic surgeons stated that they get a better result, a more natural result with subfascial breast augmentation. And early in my technique, I start using this subfascial breast augmentation. I see an amazing outcome from that technique. And so today I want to tell you what I see as a problem with dual plane breast augmentation. So there are three disadvantages that I think are the main problem with dual plane breast augmentation. The first problem is the animation deformity, which is contraction of the breast whenever a woman engage her pectoralis major muscle. And the pectoralis major muscle is the big muscle on a woman's chest wall. It's on everyone's chest wall. And especially for a woman who's very active, who has strong pectoralis major muscle. And you can see this at the gym. You look around with women who you think have a breast augmentation. You see that, whenever she flexes her pec, the breast moves. And it happens when she's at the gym, during intimacy, any daily activities, and that's frequently is the main complaint I get from my patients who come to me for revision. And another aspect of animation deformity, because in the diagram that we show you in the dual plane breast augmentation, this muscle is detached from its attachment to the fold of the breast, allows to shorten up onto the chest wall. This thing then changed the mechanics of this very big muscle. That muscle, the tendon, is attached to the humerus right here through a tendon. And because of this shortening of the muscle, over time, that tendon is becomes shortened and tight. So women with very large implants, if you notice, over time has this posture of kind of hunching over, and they often complain of tightness in their pec tendon, and some women would not know that's the problem, but oftentimes complain of shoulder pain in their armpit. So that's one major problem that I have. Second major problems, and I can show you an example in one of my patients here. You can see pictures of women in the post-op period, before and after, standing up. The breast looks perfect. It's sitting on the chest wall in the right location. You don't see the subtle problem with the dual plane subpectoral breast augmentation. It's when the woman lays down backward. Over time, that muscle, the shortened pec muscle, will lateralize. It's called lateral deformity of the implant. It pushes the implant onto the side of the chest wall. And so when women over time in the long-term follow-up will often complain of, I feel like when I lay down, my implant is falling into my armpit. So that's a problem that most plastic surgeons will not truthfully identify or realize with their long-term follow-up. And the third problem that I have, that I often see, is what we call a waterfall deformity or Snoopy dog deformity. And that's because when you put an implant underneath the muscle will then keep that implant up high. However, the woman's breasts continue to age with time. So you talk about 10, 15 years after the breast augmentation, after the woman have children, the ligament of the breast continue to age. So the breast and the skin laxity increases. So the breasts continue to descend or become ptotic, but the implants stay up high. So it creates that elongated, long appearing breast. And it's an unnatural appearance. In a subfascial breast augmentation, none of this problem occur because we are not manipulating the muscle. The muscle stay where it's meant to be. The implant is then behind the breast tissue. It shaped the breast tissue so that over time it age with the breast accordingly. So if the breast sag, the implant kind of travel with the breast, but that's okay. It's still a natural appearing enlarged breast. It's not unnatural. And you don't have the animation deformity, the hunching, shoulder hunching over, the pain, and the displacement that dual plane subpectoral breast augmentation gives you. So it is very important that you have a discussion with your plastic surgeon, not only what type of implants you choose, the size of the implants, but I think most importantly, the plane where the implant is placed. So a lot has changed. New data is out. Capsulocontracture rate is no longer what it used to be. So dual plane, radial capsulocontracture being lower than subfascial, that has been debunked. The scientific data does not pan out that way. And new implant technology, overfill breast implant, rippling deformity is no longer a concern. So subfascial placement, implant placement is still an option in very thin women. So have that discussion with your plastic surgeon.